Hey, Tom. I just want to say, for one, you are a true patriot. I love what you do. You and David Packman are the best, and keep doing it. Keep fighting the good fight. But I wanted to ask your opinion on U.S.-Mexico relations. Because the way I see it currently, we have this better than thou mentality as Americans. There doesn't seem to be much mutual respect like we do with, say, Canada.
Right.
And and correct me if I'm wrong, but it seems to me that the solution is kind of simple in a way that if we had a competent president and competent government that partnered with the Mexicans and ensured them, like, hey, we are here to help you fight your two key issues, corruption and crime. And I would think with that would not only improve the lives of Mexicans and the quality of that country, but also it would improve the quality and well-being of Americans.
I agree, and I think
I'm just looking.
I'm sorry. Go ahead.
Go ahead, Tom.
Well, I was just going to say, I think in some regards, the Obama administration moved us in that direction in some very positive ways. But right now, with the government and the administration we have, we've got a bit of a problem with regard to Mexico. And not just Mexico, I'd say this also applies to all the Muslim countries in the world. And that is that you've got an institution, the deep state, as it were, right? A government that, well, not even so much the deep state, because that's mostly all the bureaucrats who work in Washington, D.C. It's really the elected officials. You've got a Congress that is committed to doing the bidding of big multinational corporations, which means, moving jobs down to Mexico and whatnot. At the same time that you've got a president who's committed to trashing Mexicans and anybody else who speaks a language other than English or whose skin is a little bit darker than mine. And those two things, are dissonant, right? They clash with each other. And so the president's message is, be a bigot about Mexico, and Ford's message is, hey, we want to build cars in Mexico, but neither of them, neither the president nor the corporate Republicans who are, shilling for the big corporations, neither one of them are saying, we want to do what's the best thing for the American middle class, for the American working people. And, if you want to hear that, you've got to go to the Congressional Progressive Caucus, which is made up, I believe, entirely of Democrats. And they're talking about, hey, let's negotiate, fair bilateral trade deals. Let's do away with NAFTA, particularly the part of NAFTA that what's called Chapter 11, which says that corporations can sue the United States. Mexican corporations can sue the United States because they wanted to do business here in a particular way, but our regulations prevented them from doing that. I'm waiting for a Mexican corporation to sue us on our child labor laws, for example. I mean, under Chapter 11, they can sue us on pretty much anything. They did away with our dolphin-safe tuna through that mechanism. So we've got some serious problems, but you're right, Sean. But both the executive branch of our government and the legislative branch of our government are committed to screwing all of us, in different ways. Trump wants to do it for political power. The Republicans in Congress want to do it for money. Sean, I got to move along, but thank you for the call. Michael in, Tatleoko Lake, Canada. Do I have that right, Michael?
That's correct.
Whoa, I got it right. Okay, so what's up?
Okay, well, I've heard you calling before about wanting to hear about people who experience health care in Canada. I'm a family doctor here, and I've lived here all my life. And just to give you an idea, the Canada Health Act is a federal act that provides guarantees minimal standards for health care across Canada. Mm-hmm. And one of the minimal standards is that it's portable, which means that any citizen in Canada can travel anywhere in Canada and get health care. For an example, a few years ago, I broke my hip, and I live in a rural area. I got picked up by the ambulance, got taken to the local hospital, and then flown in a Learjet down to Vancouver, where I got treated. I spent a week in hospital there, got flown back by jet to my local hospital, and 2 months later, I got a bill for $500 for my contribution to the jet.
Wow!
Absolutely no cost for any of the healthcare.
No deductibles.
When you present to a hospital or a doctor's office, you open your wallet and you present your driver's license, which is a combined driver's license and care card, and that everything gets paid for.
No deductibles, no copays.
Nothing.
Wow.
Absolutely nothing. I say that.
So what is that, Michael, what does that cost you as a citizen of Canada to have access to that kind of insanely...
I'm 63 years old. I have my wife. we pay $115 Canadian a month, which is probably about $80 US.
That's your Medicare premium.
Yes.
$80 a month. And that's
$80 US a month.
For the two of you, and it provides complete comprehensive care, including Learjets.
Everything. And that means, like, if I need a hip replacement, if I need cancer treatment, if I need a CT scan, an MRI, it's all paid for. Now I hear a lot of comments about rationing of healthcare. It isn't rationed. One of our big problems is that there's a lack of enough healthcare providers to doctors and nurses to meet the growing demand. And what has changed over the years is the number of the way doctors work. When I first started out, doctors work 7 days a week, 24 hours a day, and now they don't. And people want a better lifestyle. And I would estimate now it takes about 3 doctors to do the work that one doctor used to do, and consequently, they just can't keep up with the medical schools and nursing schools can't keep up with the demand. Right. And there isn't any rationing here. Everything is kind of prorated. So we pay $115, but if that's because that would be the maximum amount you could pay. If you make less money, more and more of that would get subsidized by the government, and if you're below a certain level, it would be absolutely free.
So, Michael, as a physician, and this is a personal question, so feel free to tell me it's none of my business, but I'm curious. I'm curious. Well, in fact, not even talking about you, just broadly speaking. Here in the United States, an oncologist can easily make over $1 million a year. A general practitioner can typically make around $200,000 a year. Most specialties in between, orthopedic surgeons and heart surgeons and whatnot, make somewhere on the high end of that, $500,000 to $1 million a year. How are doctors paid in Canada?
Very well, and don't let anybody tell you that they're not. Especially if you're willing to work in a more remote, rural area like I did. Working in a rural area, make double of what somebody would make in a city like
How much is that, though?
Toronto, Montreal, because there's lots of incentives to get people.
See,
I would say the amount that doctors get paid is comparable to the States, but in Canadian dollars, the specialists may not make quite as much. Right. But there's no when you're billing for patients, I mean, all you need is their name and their card, their healthcare card number. You entered it into a computer, and 2 weeks later, you get a check from the government.
Wow. So you don't have overhead, you don't have losses, you don't have administrative expenses.
Well, no, we have overhead. I mean, you have to pay. It depends where you work. I worked in a rural area, and the local government paid for. I didn't pay anything for overhead.
No, but I mean, in overhead, what I meant was you don't have like 3 staff. Like I had back surgery last year, and I was dealing with this orthopedic clinic and whatnot. And they had like 3 people in this, I think it was a 10 or 12 person practice, who did nothing but bill insurance companies.
Yeah.
That was 3 full-time employees who were doing nothing but hassling and fighting with insurance companies. You don't have to do that. You just submit the bill.
No, and there are exceptions. Like as long as what you're there's a set with the Canada Health Act. It's a federal act, and all the provinces, which are like your states, have to sign on to it. But it's the provinces that actually make the whole system work, and it's about a 50-50 cost sharing between the provinces and the federal government.
Right. Yeah, Bernie talked about that in this program. He thought that single-payer health care should be, he wanted to follow kind of a Canadian program where it started in Canada, it started in Saskatchewan and then spread across from province to province. And as a consequence of that, you've got each state administers its own program and pays for about half of it, but then the Canadian federal government administers the other half and sets the standards for the entire nation. Right?
They subsidize it, and that's the way they kind of control it. Because if a province tries to do, to alter or to get away from the Canada Health Act, the federal government say you can do that, but we're going to take away some of your funding.
So, Michael, as a physician in Canada who has lived your entire life there, you've used the health services. You just told us a brilliant story about that, and you also practice in it. What do you say to Americans who say, oh, Canada has terrible waiting lines, they have terrible service, they have, 1/10 as many MRI machines and CT scanners per capita as the United States. You don't want to go to Canada, you don't want to get sick, and you don't want a health insurance system like Canada. We have 30 seconds, Michael. What's your response?
I feel sorry for all of you in the United States. I honestly do.
Really? Wow.
Yep.
And
there is a parallel private system. If somebody wants to go and buy an MRI, I can go to Kamloops, the closest one, pay $700 and get one in 2 days.
Yeah.
But
it's only $700. They're like 4,000.
So if I go through the public system, I might have to wait 3 months.
Yeah.
So big deal. But if it's an emergency, there's absolutely no difference between Canada and the United States.
Right.
If you need a CT scan or an MRI because you've got a stroke, it'll get done.
Yeah, and it'll get done in a matter of minutes or hours. Michael, thank you for the call. Thanks so much. And thanks so much for listening. I appreciate it. Great to hear from you. A Canadian physician speaks to Americans. I feel sorry for you.